Chest and rib injuries are common and can range from minor bruises to serious conditions like rib fractures or damage to internal organs. These injuries often result from trauma such as falls, car accidents, sports injuries, or blunt force impacts. Understanding the types of chest and rib injuries, their symptoms, and the appropriate treatment is crucial for effective management. Types of chest and rib injuries: bruised ribs, rib contusion. Cause: the direct blow or impact to the chest, often from falls or contact sports. Symptoms: pain in the chest or ribs, especially when breathing deeply, coughing, or moving. There may be swelling and tenderness in the affected area. Treatment: rest, ice application, pain relief with NSAIDs like ibuprofen, and avoiding activities that aggravate the pain. Rib fractures. Cause: significant force to the chest, such as from a car accident, a severe fall, or direct impact in contact sports. Symptoms: sharp, severe pain that worsens with deep breathing, coughing, or movement. You may feel or hear a crack at the time of injury. Treatment: pain management, rest, and in some cases, a rib belt to support the area. Surgery is rarely needed unless the fracture causes complications such as puncturing the lungs. Flail chest. Cause: a severe injury where multiple adjacent ribs are fractured in more than one place, causing a segment of the chest wall to move independently from the rest of the chest. Symptoms: severe pain, difficulty breathing, and paradoxical breathing. The injured section moves inward when inhaling and outward when exhaling. Treatment: immediate medical attention, pain management, oxygen therapy, and possibly mechanical ventilation in a hospital setting. Surgery may be required. Pneumothorax, collapsed lung. Cause: a rib fracture that punctures the lungs, or spontaneously, in some cases spontaneous pneumothorax. Symptoms: sudden, sharp chest pain, difficulty breathing, and shortness of breath. The chest may appear uneven when breathing. Treatment: emergency medical treatment is necessary. The air is removed from the pleural space, often by inserting the chest tube, allowing the lung to re-expand. Hemothorax. Cause: accumulation of blood in the pleural space, usually due to trauma or rib fractures that damage blood vessels. Symptoms: chest pain, difficulty breathing, and signs of shock like low blood pressure, rapid heartbeat, and pale skin. Treatment: emergency medical intervention to remove the blood, often by inserting the chest tube. Surgery may be needed to control bleeding. Pulmonary contusion, lung bruise. Cause: blunt trauma to the chest, often from car accidents or falls. Symptoms: chest pain, difficulty breathing, coughing up blood, and a feeling of tightness in the chest. Treatment: monitoring in a hospital, oxygen therapy, and pain management. Severe cases may require mechanical ventilation. Diagnosis: physical examination. The doctor will assess symptoms, check for deformities, and listen to breath sounds. Imaging tests, X-rays, to identify rib fractures, pneumothorax, or other skeletal injuries. CT scans provides more detailed images, especially for detecting internal injuries or complex fractures. Ultrasound may be used to detect fluid or blood in the chest cavity. Treatment. Pain management. Pain control is crucial, as it helps patients breathe deeply and cough effectively, reducing the risk of pneumonia. NSAIDs, acetaminophen, and sometimes stronger medications like opioids may be prescribed. Rest. Adequate rest is important to allow the ribs to heal, especially in cases of fractures or contusions. Breathing exercises, encouraged to prevent complications like pneumonia. Deep breathing and gentle coughing can help keep the lungs clear. Avoiding strain. Activities that involve lifting, pulling, or pushing should be avoided until fully healed. When to seek medical attention. Difficulty breathing or shortness of breath. Severe or worsening chest pain. Coughing up blood. Signs of shock, e.g., fainting, rapid heartbeat, sweating. Visible deformity or instability in the chest wall. Prevention. Use of protective gear. Wearing seat belts, using protective equipment in sports, and ensuring home safety can help prevent chest and rib injuries. Strengthening exercises. Core and upper body exercises can improve muscle strength and support around the rib cage, reducing the risk of injury. Chest and rib injuries can be painful and sometimes serious. Early recognition and appropriate treatment are key to a full recovery. For severe injuries, especially those involving difficulty breathing or signs of internal damage, seeking immediate medical attention is critical.